What is the clinical presentation of giant cell arteritis?
So the main clinical presentation of GCA is involved the external carotid branch and the temporal artery inflammation, leading to cephalic signs, the temporal headache, the scalp tenderness, the abnormal examination of temporal artery, the tongue and jaw claudication, and sometimes the complication that we want to avoid is the sudden visual loss linked to the inflammation of the optic nerve. But in the recent years, I would say 10 or 15 years ago, with the advance of the vascular imaging, we deal with another form of the disease, which is the large vessel vasculitis manifestations, which is different in terms of presentation because this form is less symptomatic, involves younger patients, more female patients, and the main signs are the alteration of the general status, more blood inflammation, and the higher risk of vascular complication. These two presentations are usually not overlapping, but sometimes they may overlap. And they may also be associated with the PPR, which is found in around 40 to 50% of patients at diagnosis or later on.
What is its relationship to polymyalgia rheumatica?
When we deal with the new classification criteria for GCA published in 2022, we can see some different aspects as compared to the previous criteria. The first aspect is the age, because people have to be older than 50 years old at diagnosis, which is younger than what we used to take before. Then it combined the two aspects of the clinical presentation of GCA, meaning the two clinical presentations, the cephalalgic presentation and the large vessel vasculitis presentation. But we deal also with the PMR presentation, and we deal with the certain form of PMR which associate PMR, but also the involvement of the aorta, which is present in 50% of these PMR patients. So it means that patients with PMR and aorta involvement is now considered as having a giant cell arteritis, which is quite new and which is really important because it takes into account the involvement of the large vessel and the inflammation of large vessel diagnosed by imaging technique. And it's really important because in the next year, probably the treatment of this patient will change. It's not really taken into account in the international recommendation for the treatment of these patients, but for sure, in the next following year, it will change the way we deal with the treatment of these patients, since we know that patients with PMR and also with associated large vessel involvement are quite similar to the patient with GCA without PMR, but with large vessel vasculitis, because the complications may be the same. And the way we're going to care when we follow this patient will be probably very close. And we'll have to take this into account in the next year.